Today, doctors and nurses started getting vaccinated at Ohio Health Riverside Methodist Hospital. The hospital started receiving the vaccine yesterday. We told you about that, but they didn't administer them until today. Ohio State Wexner Medical Center began vaccinating workers on Monday, while Mount Carmel says it will not receive its first doses of the vaccine until next week. Now, we know that many of you have questions about this COVID-19 vaccine, so we asked you to send them to us.
Tonight, we picked five questions directly from you. 10 TV's Angela Reigert took your questions to a doctor at OSU's Wexner Medical Center to get some answers.
Doctor, we have some viewer questions, 5 of them about the vaccines. So I'm just going to start, okay?
Great, let's do it.
Okay, all right. First question. Is there concern about getting the COVID-19 vaccine shortly after getting my flu shot?
Yeah, this is a great question because we want everybody getting their flu shots, that's for sure. The guidance that we're getting from the CDC is that 14 days either after or before another vaccine is when the COVID vaccine should be delivered. So if you've gotten your flu vaccine, wait 14 days. If you're getting your COVID vaccine, then wait 14 days for your flu shot.
Okay. Number 2, should I get a vaccine if I already had COVID-19?
Yeah, so right now we're recommending that you do. There's some question as to how long the natural immunity from being infected with COVID-19 will last. There's some data that indicate the immunity from the vaccine is even better than the natural immunity. So right now, the recommendation is that everybody, with the exception of those folks who have an allergic reaction, an anaphylactic reaction to one of the ingredients in the vaccine, goes ahead and gets it.
Some of our viewers have asked us this third question. Will I have to pay to get the COVID-19 vaccine? What's your understanding with that?
Yeah, this is a great question. I mean, we're always concerned about hidden healthcare costs. My understanding is that because this is a vaccine that's supplied by the federal government, there will not be a charge for individuals. Don't quote me on that, but that's my understanding at this point.
No, that's good to know. Things definitely change. We've learned that during the pandemic, of course. And, you know, there are some different vaccines we're hearing about, right? We've heard of the big 3. One of our viewers wanted to know, do I need to know which is best for me, or am I okay to get any of them?
Yeah, really good question here. We always want our patients to be informed about their risks and the benefits of any therapy that they're undergoing. It's our understanding right now, based on the data that's come out of the clinical trials, that there really is no specific advantage for any specific population or group of comorbidities for one vaccine versus the other. So they're quite interchangeable. They have very similar efficacy, effectiveness, and very similar side effect profiles as well. So really no concern about that, but certainly know what type of vaccine you might be getting. It's just good to be informed. Last
but not least, the big question, is it safe?
Yes, it is by all accounts right now safe. The one caveat to that is there's a component of the vaccine called polyethylene glycol. If you had an anaphylactic reaction to that, that's the one contraindication to the vaccine. If you had an anaphylactic reaction to that, you will know. We're certainly keeping a close eye on people just to make sure that somebody with an unknown allergic anaphylactic reaction doesn't have a bad response. But that's really the only significant safety risk. For everybody else, it's bearing out to be very, very safe. And also, as we said, very effective, up to 95%.
Thank you very much, Doctor, for this and for the work you do. We appreciate it.
Oh, it's my pleasure. Thanks for having me on.
And our thanks to Angela Reigert tonight, and keep sending us your questions. This won't be the last time we take a look to get some answers for you for those questions. Just text the questions to that number on your screen, 614-460-3345. We read them all and pick the best ones to take to the experts.